Hi, I'm Dr. David at Magnolia Skin Center. We're doing another uh, video about educational piece about one of my absolute favorite subjects, Agnes radiofrequency, specifically today talking about non-surgical facelift. Look at some of my other Agnes videos so that you already understand what Agnes is about. It's an injectable radiofrequency where I have a sculpting tool where I have needle or needles that I go in under the skin surface. They're insulated at the hub so I can deliver energy deep under the skin. And when I do that, I can shrink wrap the skin. I can also lift it and then tack it to a different place on the skin, and that turns on a regenerative response, which then over the next 4 months afterwards regrows your collagen, elastin, and fibrin to give you tighter, younger, thicker, moister, glowing skin. So I can really sculpt your face to give you a non-surgical facelift with this treatment. So let's get into the question. How can a needle and heat treatment lift sagging jowls and smooth laugh lines without surgery? Okay, what is he talking about sagging jowls? This area, one of the common areas is here where you've got fat pads, and this will come down so you can't see the jawline anymore. So I can go in with these, with Agnes, I can tack and vector and pull, and I can also uh, get rid of these fat pads here, and I can tighten the skin so that now this is tight. I can see your jawline again, and all this is lifted up so you get your young, tight jaw back again. Okay. When it talks about laugh lines, anywhere you've got wrinkles, I can go underneath and treat with Agnes, and it will regrow. It will shrink the skin and it will regrow the connective tissue underneath. The reason why you have wrinkles is because the skin has lost the connective tissue underneath, and so it's falling into a crevice because the connective tissue is gone. If I get the connective tissue regrowing, it will push the wrinkle back out again. Okay. How does the recovery time for this compare to a surgical facelift where I'd be hiding for weeks? Well, obviously, when you have a surgical facelift, there's a cut, a lift, there's an undermined, so all these blood vessels are broken and the skin is removed sort of from the deep structures. It's pulled and it's cut and it's sewed back together. So the recovery from that is significant for many weeks. This treatment, while yes, you can have some bruising, but and some swelling, but basically for the most part, you're not going to have. We're not doing that kind of tissue destruction because we haven't cut anything. I haven't separated your skin from the deeper structures. I've just lifted and tacked it, shrink wrapped it, and raised it and elevated it. So the recovery time is um, nothing compared to a surgical facelift. Okay. Will this lift give me a completely natural, refreshed look rather than a tight, old plastic look? Yes, because I'm not removing any skin. I'm not really. I'm not really. Relocating skin dramatically across the face, where this literal piece of skin is now over here. What I'm doing is I'm shrink wrapping the skin as I go. So if I treat in this area, then this whole area of skin is basically shrunk from this much skin to this much skin, but it's all evenly shrunk. So it looks naturally placed. It doesn't look like it's been moved. Okay. Can this tighten up my loose neck skin and sharpen my jawline at the same time? Absolutely. We can do lower face, we can do the submental area, we can do the necks, we can do all these areas, and we can lift and tighten. And basically, I just study your face and your neck and see where we need to tighten and shrink wrap to get the result we want for a tight neck, a young neck, get rid of this sagging under here, get rid of this fat pad under here, give you a tight jawline for a snatched neck, okay? Or snatched jawline. How many months do I have to wait to see the final collagen boosting lifting effects? Okay, you will see effects right away, but the collagen, elastin, and fibrin keep regrowing for 4 months plus after this procedure. So you will continue to see improvement keep coming in for more than 4 months after this procedure. So we wait after we've done this procedure, we wait a minimum of 4 months to decide what more you may need because it's going to keep improving for that long. Okay. Who is the perfect candidate for this? And when is someone sagging too advanced for a non surgical option? Okay. That's a great question. there's really anyone is a candidate for this, because there are people that you might look at and say, okay, well, there's so much sagging that really it needs to be cut. But here's the problem with that. First of all, um, cutting is not going to regenerate the skin. This is going to regenerate the skin and give you tighter, thicker, healthier, younger skin back. Surgery can't do that. So you want to do this even if it's a very advanced case. The second thing is, just because I can't take you in one procedure all the way back to completely tight doesn't mean that you don't want to tighten and lift with this. You may need multiple procedures depending on how tight you want to get, but there's really no one that's too bad to get improvement with this. The third thing is, and in my experience, there are many people who say under no circumstances are they going to have surgery. They do not want surgery. So they understand that it may take multiple treatments to get there, or that they're happy with it with improvement, even if it's not all the way where they want to get, because they just simply do not want surgery. They don't want the risk of the anesthesia. They don't want all the issues. They don't want the cost of the surgery. So there are many people who just, period, don't want surgery. Um, is this a is this a permanent fix for my aging skin, or will my face start to sag again in a few years? Okay, there is no permanent fix, of course. We are always going to age. So the way to think about this, including surgery is not a permanent fix. Okay, you are going to worsen after the surgery and you age again after the surgery. So think of it, the way I like to explain it is this. If I take your face from 70 to 45, or from 55 to 35, or whatever, then you're going to age from that place again. So even if you never did anything again, you're always going to look better than if you had never done anything, and you will just age from that age again. So I hope that helps you understand a little bit more about what we're doing here at Magnolia Skin Center, and I'm Dr. David.